First, we need to verify the order. Second is confirms the client's identification, compares the name with the name on the client's ID bracelet. Then, i-check natin yung bracelet ng patient natin. And also, titignan uli natin yung order ng doctor. Third is provide privacy and explain the procedure to the client. Ma'am, good afternoon po. My name is Erica Joyce, your student nurse for today. And now, I will be performing obtaining electrocardiogram. Is that okay? Fourth is washes hands, don gloves, a face shield, and a gown if needed, and follows standard precautions. Fifth is, as you set up the machine to record a 12-lead ECG, explain the procedure to the patient. Tell the patient that the test records the heart's electrical activity and it may be repeated at certain intervals. Emphasize that no electrical current will enter his or her body. Tell the patient that the test typically takes about 5 minutes and ask the patient about allergies to adhesive as appropriate. Explanation relieves anxiety and facilitates cooperation. Possible allergies may exist related to adhesive on ECG leads. Ma'am, we will be doing electrocardiogram test and it will typically takes for about 5 minutes. Do you have any allergies to adhesive? Place the ECG machine close to the patient's bed and plug the power cord into the wall outlet. Having equipment available saves times and facilitates accomplishment of that. If the bed is adjustable, raise it to a comfortable working height, usually elbow height of the caregiver. Having the bed at the proper height prevents back and muscle strain. Komportable naman po ba kayo? Have the patient lie semi-Fowler's position in the center of the bed with the arms at the sides. Raise the head of the bed if necessary to promote comfort. Expose the patient's arms and legs. Expose natin yung patient's arms and legs. And drape it appropriately. Encourage the patient to relax the arms and legs. Ma'am, mag-relax lang po kayo. Proper positioning helps increase patient comfort and will produce a better tracing. Having the arms and legs relaxed minimizes muscle trembling, which can cause electrical interference. Select flat, fleshy areas on which to place the electrodes. Avoid muscular and bony areas. If an area is excessively hairy, clip the hair. Do not shave hair. Clean excess oil or other substances from the skin with soap and water and dry it completely. Shaving causes microabrasions on the chest skin. Oils and excess hair interfere with electrode contact and function. Alcohol, benzoin, and antiperspirant are not recommended to prepare skin. Apply the limb lead electrodes. The tip of each lead wire is lettered and color-coded for easy identification. The white or RA lead goes to the right arm. The green or RL lead to the right leg. The red or LL lead to the left leg. And the black or LA lead to the left arm. The red for left leg. White for right arm. Green for right leg. And black for left arm. A is fill the contact paper of the self-sticking disposable electrode and apply directly electrode to the prepared site, as recommended by the manufacturer. B is position disposable electrode on the legs with the lead connection pointing superiorly. Having the lead connection pointing superiorly guarantees the best connection to the lead wire. Connect the limbed lead wires to the electrodes. Make sure the metal parts of the electrodes are clean and bright. Dirty or corroded electrodes prevent a good electrical condition. Expose the patient's chest. Apply the precordial lead electrodes. The tip of each lead wire is lettered and color-coded for easy identification. The brown or V1 to V6 leads are applied to the chest. Peel the contact paper of the self-sticking disposable electrode and apply directly to the prepared site, as recommended by the manufacturer. Position chest electrodes as V1 fourth intercostal space at right sternal border. V2 fourth intercostal space at left sternal border. V3 halfway between V2 and V4. V4 fifth intercostal space at the left mid-clavicular line. V5 fifth intercostal space at anterior axillary line halfway between V4 and V6. V6 fifth intercostal space at mid-axillary line level with V4. Proper lead placement is necessary for acute test results. 14. Connect the precordial lead wires to the electrodes. Make sure the metal parts of the electrodes are clean and bright. Dirty or corroded electrodes prevent a good electrical connection. 15. After the application of all the leads, make sure the paper speed selector is set to standard 25 meter per second and that the machine is set to full voltage. The machine will record a normal standardization marked square that is the height of 2 large squares or 10 small squares on the recording paper. Then ask the patient to relax and breathe normally. Ma'am, hinga lang po kayong malalim. Instruct the patient to lie still and not to talk while you record the ECG. Press the auto button. Observe the tracing quality. The machine will record all 12 leads automatically, recording 3 consecutive leads simultaneously. Some machines have a display screen so you can preview waveforms before the machine records them on paper. When the machine finishes recording the 12-lead ECG, remove the electrodes and clean the patient's skin if necessary with adhesive remover for sticky residue. Removal and cleaning promote patient comfort. Ma'am, tatanggalin na po natin. (19) After disconnecting the lead wires from the electrodes, dispose of the electrodes. Return the patient to a comfortable position, lower bed height, and adjust the head of bed to a comfortable position. Proper disposal deters the spread of microorganisms. Positioning with head adjustment promotes patient comfort. Lowering the bed height promotes patient safety. Then discard. 20. Observe and practice body mechanics at all times and show calmness while performing the procedure.